Close your eyes and imagine you are suffering from a persistent, agonizing fever or a deep wound that has turned a worrying shade of purple. In the modern world, you would head to a sterile emergency room. But in the year 1300, your destination is the local Hotel Dieu, the house of God. As you approach the heavy stone doors, the first thing that hits you isn't the sight of doctors, but the smell. It is a thick, cloying miasma of incense, unwashed bodies, rotting gangrene, and wood smoke. You are not entering a place of science. You are entering a place of transition between this world and the next. To understand why you wouldn't survive a medieval hospital, you first have to understand that these institutions weren't built to fix your body. They were built to save your soul. When you are admitted, you aren't greeted by a doctor with a clipboard. Instead, you are met by monks or nuns. Their primary concern isn't your blood pressure or your infection. It's your last confession. In the medieval mind, sickness was often viewed as a physical manifestation of sin or a divine test. Therefore, the treatment began with prayer. You would be placed in a long, drafty hall called an infirmary, often sharing a straw-filled bed with 2 or 3 other strangers. Imagine lying there, shivering with pneumonia, while the man to your left is dying of dysentery and the man to your right has an open, festering ulcer. Cross-contamination wasn't a theory, it was a guarantee. The straw you lay on was rarely changed, becoming a breeding ground for lice, fleas, and the very bacteria that were already killing you. If a physician did visit you, his methods would likely finish what the disease started. Medieval medicine was based on the theory of the 4 humors: blood, phlegm, yellow bile, and black bile. The belief was that you were sick because these fluids were out of balance. To fix you, the doctor would turn to bloodletting. Using a specialized knife called a phleem or a jar of hungry leeches, they would drain significant amounts of your blood to release the heat of the fever. In your already weakened state, this loss of blood didn't cure you. It sent your body into hypovolemic shock, crashing your blood pressure and ensuring your heart didn't have the strength to fight the infection. Then came the pharmacy. Forget aspirin or antibiotics. Medieval medicine was a chaotic mix of herbalism and superstition. You might be forced to swallow theriac, a famous potion containing dozens of ingredients, including opium, ground-up vipers, and honey. While the opium might dull your pain, other treatments were far more sinister. If you had a head injury, you might undergo trepanning, where a surgeon would manually drill a hole into your skull with a hand-cranked bit to let out the demons or pressure. There was no anesthesia, save for perhaps a sponge soaked in vinegar and hemlock that often proved fatal itself. You would be fully awake, held down by strong-armed monks, as you felt the vibration of the drill entering your bone. The surgeons of the hospital weren't even considered scholars. They were barbers. Because they already owned the sharpest razors, barber surgeons were the ones tasked with amputations and tooth extractions. If your leg had developed gangrene from a simple farm accident, the hospital cure was quick and brutal. They would tie a leather strap above the site, take a jagged bone saw, and remove the limb in under a minute. The stump would then be cauterized, literally seared shut with a red-hot iron or dipped into a vat of boiling oil to stop the bleeding. The shock alone killed many. For those who survived the table, the hospital fever, sepsis, would usually claim them within a week, as the surgeon moved from one patient to the next without ever washing his hands or his tools. Diet was another area where the hospital failed the patient. While the monks tried to provide food, medieval sick bay nutrition was often based on what was available. During lean months, you might be fed nothing but thin grain pottage or stale bread. If the water was contaminated, which it almost always was in urban hospitals, your recovery would be interrupted by a violent bout of cholera, further dehydrating a body that was already being bled dry by leeches. The architecture of the hospital itself was a silent killer. These stone buildings were massive, damp, and impossible to heat. In the winter, the cold would settle into your bones, turning a mild cold into terminal pleurisy. The windows were often kept small or shuttered to keep out bad air, but this only trapped the carbon monoxide from the charcoal braziers and the airborne pathogens from dozens of coughing patients in a single, unventilated room. You weren't just breathing air. You were breathing the slow death of everyone around you. The most terrifying aspect of the medieval hospital, however, was the waiting room. In many large hospitals, the chapel was positioned so that every patient could see the altar from their bed. You would lie there, day and night, listening to the constant chanting of the office of the dead. You would watch as the person in the bed next to you was wrapped in a shroud and carried out, knowing that the monks were already eyeing your bed for the next arrival. There was no privacy, no silence, and no escape. To survive a medieval hospital, you needed a miracle, literally. The odds were stacked so heavily against the human body that recovery was seen as a divine intervention rather than a result of the care provided. You were entering a system that understood the soul perfectly but was completely blind to the cell. If the infection didn't kill you, the bloodletting would. If the bloodletting didn't, the surgery would. And if you somehow survived the barber's saw, the filth of the ward would be waiting to finish the job. In the end, the medieval hospital was less of a place to get well and more of a grand, communal foyer to the afterlife.